Many people still assume that there's very little scientific evidence regarding complementary and alternative medicine therapies. But the truth is, many of these approaches can have an enormous impact on your health and well-being. Here are a few to consider. Aromatherapy can be used to treat stress, sleep disorders, and mood disturbances, including depression and anxiety. Aromatic essential oils from plants are extracted, distilled, and typically mixed with other substances like oil, alcohol, or lotion, then applied to the skin, sprayed into the air, or inhaled. Inhaling a scent triggers powerful neurotransmitters and other chemicals that result in an improved mood. Acupuncture has been proven effective in treating conditions including migraines, chronic pain, and insomnia. A key component of traditional Chinese medicine, acupuncture is practiced by inserting extremely thin needles through the skin at strategic acupoints on your body. This arouses the nervous system to release endorphins to the muscles, spinal cord, and brain. This can change the experience of pain and trigger the release of other chemicals and hormones that influence the body's internal regulating system. Massage can help treat migraines, improve sleep quality, enhance immune function, and reduce low back pain. Using the principle that touch is healing, massage involves rubbing the soft tissues of the body, such as the muscles and connective.
Welcome back to Philippines Uncut. I'm Buddy Cunanan, and tonight's topic is laser therapy in the Philippines. And joining us still are Dr. Danilo Delfin, cardiologist, and Dr. Madge Gialone, family medicine and occupational health practitioner. Both of them specializing in laser therapy here in the Philippines. Welcome back, Dr. Gialone and Dr. Delfin, for our second segment. Now, we ended the first segment talking about the origin of this machine, and apparently this technology is not U.S.-based technology, no, Dr. Delfin, it's Russian.
Apparently, the first machine that was invented was an American machine.
Okay.
That was in 1967.
All right.
So by Theodore Maimon.
Okay.
And then in 1970s, Moscow in Russia, they established the Research Institute for Laser Medicine. Then in 1980s, in America, in US, they founded the American Society for Laser Medicine and Surgery.
Yes.
Here in the Philippines, this machine was introduced in 1994.
Yes.
By Dr. Koretskin, a Russian physician,
All right.
in collaboration with the Department of Health and other centers like Philippine Heart Center and Kidney Center.
Okay.
Apparently, there was abrupt campaign for this kind of modality.
Yeah.
I don't know the reason, but lately in 2012. Mr. Ronald Santos, our good friend,
Yes.
established this in Cebu.
Yes.
And then, because this is very popular in Europe,
Yes. Yes.
especially in Moscow, in Russia, in Ukraine, in
Yes.
Germany,
Yes.
in London also, and some other Asian countries. So, and then that was in 2012, when Mr. Santos put up this in Cebu. Then here in Manila, we have integrated laser in complementary medicine in Medical Plaza Ortigas.
Okay. Now, Dr. Madge, did you hear about? Were you aware of this kind of technology before, during your practice? During your years of practice, did you hear about laser therapy already?
Yes, but not this one. When I work in a skincare company, that I noticed that the derma clinic is using left and right of these laser machines.
Yes, yes.
Mm.
Very interesting, eh? So, okay, Dr. Delfin, going back to your experience as a cardiologist here, I understand that your clinic in Cebu has had several cases where people have been scheduled for heart bypass, have actually gone through the sessions, the treatment sessions using this machine, have gone back to their cardiologist, have undergone another test and have undergone an angiogram, and have seen that the blocks in their heart have disappeared. Now, I understand in your clinic in Cebu there have been several sessions like this. Several cases of this nature.
Sorry.
Yes. Yes.
Yeah.
Could you
We
care to
have,
comment?
we have heard a lot of interesting stories of some cardiac patients in Cebu,
Okay.
including those patients with significant coronary artery disease
Okay.
scheduled for bypass surgery.
Yeah.
And then they reported that the surgery was postponed because there was an improved condition of the patient. But
Okay.
we're trying to document all of these. We're trying to ask all the data information. Right now here in Medical Plaza Ortigas, we have a data registry of our patients, including Cebu.
Yes.
So we have to find out. We have to find out if there is really a diagnostic confirmation regarding improvement
Yeah.
of the patient.
Yeah.
But right now, as far as clinical manifestation, symptomatology, a lot of patients are saying that they are much improved after using this intravenous laser therapy.
But it is a fact, right? You've had patients in Cebu who have really been, in fact, I think in one case we talked before offset was about a captain on the ship who was who was about to undergo bypass, and it was a requirement for him to go back on board the ship and work as a captain. But then he underwent this treatment, and apparently without having to go for a bypass, he was able to go back to work. This is an actual case, right?
Yeah. Actually, the bottom line of this
Yeah.
procedure is improved microcirculation. But not only that, there are some what we call vascular growth factor
All right.
that are being
What does that mean? Vascular growth factor. What does it mean?
those are components in the blood,
Alright.
especially in the endothelium,
All right.
that improves the smallest blood vessels in the heart, or the microcirculation.
Yes. Yes.
So, based on several studies right now regarding on this machine,
Yeah.
there are some articles that showed evidence that has improved blood vessels, improved microcirculation, or especially including the smallest blood vessels in the heart.
Okay. I understand that we have a video taken in Cebu of some of your patients, and what I mean, it's not really a testimonial, but really their experience
Yes.
with intravenous laser therapy. So we're going to show the video now of intravenous laser therapy center in Cebu.
Cebu.
Yes.
Oo. And I was not feeling well. And I started with this, and I feel better and better and better every time. There's no harm in trying, I believe. So, actually I was also asking God, Lord, what's this? I will try, and I still need you, okay? Because everything could be possible only when you are included in everything that I do. Kasi noon, meron talaga akong dapat meron kasamang check up sa hospital, yung magpunta sa laboratory or wherever, but now me and the Lord.
So, yun nga, candidate nga ako sa bypass. That was a month ago, around 45 days na talagang gusto ko na magpa-opera. So, first of all, my concern is, what will happen to me after my operation? Baka mainutil na ako. Wala namang guarantee nga siguro eh. Nobody can guarantee yun. Secondly, kulang naman ako ng pera. Hindi naman siguro pauutang yung hospital tsaka yung doktor, no? Pa-laser ka, Mr. Tan, 10 times, 10 session. Then, binigyan niya ako ng mga prescription, ng mga gamot niya. So, I feel better. Mga 3 session pa lang, I walk in the mall. Sinubukan ko yung resistance ko. Sinubukan ko ron, maganda. So, every day, nagpapa-laser ako kay Ma'am Glor. After my laser session, I go to SM or in Ayala. Yun, tuloy-tuloy ang lakad ko. Tapos, pag medyo pagod na ako, upo ko. Unlike before, when we went there, hinihingal na ako. Sabi ko, ayun, hindi ko na kaya. I'm not expecting that I will go back to the normal. I'm expecting na wala ng pain, I can travel, walay ka ng short breath, walay chest pain, di ba? Walay ka ng low voltage ang kon mo, no?
For me, my concerns is the fatty liver, the myoma, and medyo weak yung heart ko, ganon. But in general, okay lang kasi gumiginhawa pa. Yung concern ko is more on my sister. Yung for a normal person, the TSH should be 4.2. That's for yung wetter na normal. Yung sa ate ko, since 2009, the highest was 10 something, almost 11. Then, for the longest time when she was still taking the medicine, pinaka-lowest is 7.9 something. So, that means hindi rin normal. Kay 4.2 man yung normal, di ba? So, when we came, umuo siya. Sabi na, sige, I will give it a try. Ginawa niya within 15 days. Nag-diligent siya almost every day, 15 days. On the 15th day, she went home and showed me the lab test. She was so happy. 4.23 from 7.9, that's only 15 days. Imagine how many years, 2009 to 2014, the medicine that she's taking. Wala. So, yun. So, doon ako, sabi ko, ako rin, magano na rin ako. Yun. Within 15 days. Yes. Yes.
That's nice. So, okay na rin po si sister ngayon.
She's now in Singapore. Having her vacation.
Nag-vacation, so sobrang tuwa. Kayo naman po, ano na po, ilang sessions na po kayo?
I'm done with my 11 sessions and these are my maintenance. Oh, yeah.
So, how do you feel naman on your part?
So far, na-improve yung liver ko. Hindi na siya tapos yung cholesterol, tsaka yung ko, talagang normalized lahat.
Normalized na
Yeah.
siya.
Very interesting video, doctors. No? I mean, we saw 3 patients there, and all of them claiming that they feel better, their tests have improved. Yung dalawa, heart patients, 2 of them are heart patients, the other one, hyperthyroidism. She was talking about how her cholesterol is normalized, she mentioned other things, liver indicators that are normalized and things like that. Now, in your experience now with laser therapy, you can see that this is something common. I mean, people have really come back and reported saying that they have improved. They feel better. Their tests have come back and their tests have come back much improved. Doctors.
Well, our experience here in Metro Manila, we have our own clinic here in Manila. Some of our patients had improved symptoms, no? Less chest pain, improved blood pressure, improved autosaturation,
Yes, yeah.
or oxygenation of the lungs, improved mobility.
Yes.
So all of our patients here are saying that they are satisfied with this treatment
Yes.
or modality.
And it's so interesting because we actually saw people hooked up to your laser, and it's such a simple procedure, and you can see they're talking while they're undergoing treatment, and it seems very simple. It seems like something anyone can do,
Yeah.
and it's something like anyone can undergo. No? So wait, doctors, we have to pause for another break, but in the third segment we're going to talk about how this can be applied not just to all the diseases that you mentioned, but also to aesthetics and beauty.
Yeah.
Diba, doctor?
Yeah.
So more of intravenous laser therapy when Philippines Uncut returns.